For centuries, it's been the ultimate question. Are we just complex biology, or is there something more? Recent breakthroughs in neuroscience and quantum physics have reignited the most profound debate of all. Did scientists finally find proof of the human soul? The strongest evidence comes from near-death experiences, NDEs. Patients who were clinically dead often report lucid, vivid experiences outside their body, sometimes even describing events happening in the room or in other locations. How can a non-functional brain generate consciousness? Researchers like Dr. Bruce Greyson argue this suggests a mind separate from the brain. Then there is the concept of quantum consciousness. The Orch OR theory proposed by Dr. Stuart Hameroff and Sir Roger Penrose suggests consciousness is non-computational and stored in tiny structures in the brain called microtubules. When the body dies, this quantum information isn't lost, it simply returns to the cosmos. They call this a form of the soul's existence. However, the skeptics push back. Many scientists claim NDEs are just brain misfires, a surge of chemicals released during trauma. They argue that as long as consciousness is correlated with brain activity, there's no need for an unprovable, immaterial soul. The mind, they say, is simply what the brain does. So, did scientists finally prove it? The answer is complex. While they haven't produced a definitive physical soul, the mysteries of consciousness are opening up new pathways that challenge conventional materialist views. The search continues. Near-death experiences are commonly reported during cardiac arrest, severe trauma, or anesthesia complications, featuring vivid awareness when normal brain function appears absent. Some patients describe tunnels, light, life reviews, and verifiable details from operating rooms. Accounts of seeing surgical tools, hearing conversations, or noticing objects on high shelves raise the question of perception without functioning senses. Stories like the shoe on the roof became emblematic, prompting efforts to test whether out-of-body perception can be verified. Large studies, including hospital-based projects that place hidden images only visible from above, have tried to capture objective evidence during resuscitation. Results so far are intriguing but inconclusive. A few suggestive reports, many null trials, and significant methodological challenges. Despite cultural differences, themes recur: peace, presence of others, panoramic memory, and a boundary or choice to return. The central puzzle remains: experiences with clarity reported when measurable brain activity is minimal or disordered. Skeptics note that drugs, oxygen deprivation, and carbon dioxide shifts can induce tunnel vision, euphoria, and dissociation similar to NDE features. They argue memories may form upon recovery, then be misattributed to the period of flatline, compressing timelines in recall. If even one veridical perception were conclusively documented, it would force a re-examination of the brain-only model. But science demands repeatability and controls. For now, the evidence invites curiosity, not closure. Under extreme stress, the brain releases chemicals and experiences oxygen drops that can produce bright lights, sounds, and feelings of separation. Stimulation of the temporal parietal junction can trigger out-of-body illusions in awake subjects, suggesting a neural basis for that sensation. Memory consolidation can occur rapidly during recovery, weaving fragments into coherent narratives that feel continuous. Expectations and cultural scripts may shape the content, explaining why some elements vary across societies. Even strong correlations do not prove causation, that the brain fully generates consciousness rather than filters or correlates with it. Reports during deep anesthesia or brief flatline remain controversial because instrumentation may miss subtle residual activity. Neuroscience explains many features of NDEs, yet key anomalies persist. Both sides agree, better measurements are essential. Is the mind what the brain does, or does the brain transmit something more? The distinction drives the research agenda. Consistent, replicated cases of perceiving hidden targets during documented brain inactivity would move the needle most. But patient safety, consent, and unpredictable timing make such tests difficult, keeping definitive answers out of reach. Orch OR proposes quantum computations occur in microtubules, where objective reduction collapses superposed states into conscious moments. Proponents argue biology may shield coherence long enough to matter, synchronizing with brain rhythms. Critics counter that the brain is warm and noisy, leading to rapid decoherence that would destroy delicate quantum states. Another challenge is scaling, linking quantum events to large-scale neural activity and subjective experience. When advocates say information returns to the cosmos, they mean quantum information may persist as physical degrees of freedom, not a ghostly duplicate of a person. Whether that equals a soul in a personal sense is a philosophical leap, not a settled scientific claim. Quantum effects appear in biology, photosynthesis, avian navigation, suggesting life can harness coherence under certain conditions. But demonstrating brain-relevant quantum computation and linking it to conscious content remains an open frontier. The quantum hypothesis is provocative, possible in principle, unproven in practice. For now, it expands the landscape of what consciousness could be. What would count as proof? Science needs operational definitions, measurable predictions, and independent replication. If a soul is immaterial, measurement must hinge on effects on matter, signals, information transfer, or anomalous perception. Hidden target studies aim to test out-of-body claims by placing randomized images detectable only from elevated viewpoints. Strict blinding, timestamps, and independent verification reduce bias and chance matches. Reality check: cardiac arrests are unpredictable, sensors vary, and signal is rare, yielding low statistical power. Multi-center collaborations and standard protocols could increase sample sizes and robustness. Ethical research prioritizes patient dignity and care over experimental ambition. Personal meaning matters, whether one interprets NDEs as spiritual journeys or neurobiological events. Advances in neural recording, synchronized video, and automated analysis may clarify timing and content, bringing us closer to testable answers. Have scientists proven the soul? Not yet. Evidence from NDEs challenges assumptions, neuroscience explains much but not all, quantum ideas expand possibilities, proof would require clear predictions, careful measurements, and results anyone can replicate. Until then, curiosity and humility guide the search. If this exploration sparked thought, subscribe for more deep dives into science and consciousness. Share your perspective respectfully in the comments. What evidence would convince you?